In 2017, the Global Financing Facility supported the government of Nigeria in developing its investment case and funded some parts of it through the Accelerating Nutrition Results in Nigeria project, Nigeria State Health Investment Project, and the Basic Healthcare Provision Fund, all to enhance the country's health outcomes for women, children, and adolescents.
With the Basic Healthcare Provision Fund, more women and children, even men, can have access to quality and affordable healthcare services. Pregnant women can access healthcare services, antenatal, delivery, everything is free so far they are registered under the Basic Healthcare Provision Fund.
Some of them that doesn't have access to free health, especially the pregnant women, they end up delivering at home. Some of them that are sick, instead of coming to the facility, they look for somewhere else to go, and at the end, they give them wrong treatment. But now, Basic Healthcare Provision Fund has helped a lot, especially to the people living in this community and the community around. Our pregnant women, they come to access services here. Not only antenatal services, there are other services that are free, such as malaria, hypertension, diabetes, and so on. The government also provides mama kits, that is delivery item, for those that register with Basic Healthcare services.
For my firstborn, everything I paid. But for this one, no, I didn't pay kobo, even for the treatment. Even if like I'm sick like this, I will just come, they will treat me free. My son, the same thing.
With the civil society organizations, with donors, with even governments of Nigeria, we can actually do a meet and review to see how far we have gone and where we are going, so that if there is any way we need to tweak or modify, we modify and then implement meticulously.
In 2021, the Joint Learning Agenda Nigeria was birthed after training trainers on universal health coverage, budget tracking, and advocacy in health financing. This initiative is of GFF and other global health initiatives. Currently, the coalition was funded to carry out advocacy on health insurance in Nigeria, with a focus on the implementation of the National Health Insurance Act 2022. A scorecard is developed at national and subnational to track implementation.
Global Financing Facility had actually supported in great deal, not only the government, but even civil society organizations in the countries they are supporting. GEMOB Initiative is also one of the beneficiaries of the Civil Society Fund from GFF. Right now, we are doing a case study. We are assessing the alignment of global health initiatives in Nigeria. How is this being coordinated appropriately to ensure that the well-being of women, children, and adolescents are being prioritized and are actually being improved?
While we've made significant progress since our inception, there is still a considerable journey ahead. The aim for GFF is to raise $800 million. This will unlock $20.5 billion of aligned financing of prioritized national health plans.
Invest in GFF to unlock more fundings, more donor fundings, more domestic resource being mobilized, and more commitments from the government. Your investment will do a lot.
Let's make it happen. Together, we will deliver the future.